Hi everyone. Hang on, we're just gonna do a quick check. Just Hi everyone. Hi Dr. Ravin. So nice to see you here. I'm just trying to get Dr. Shaz to join in. Hang on. Because I'm not so tech savvy,
Right.
yeah? So
Should
hang
I?
on. Hi, Dr.
Hi.
Shaz.
Should I switch it around? Because you're
Yes. I think you have to switch your picture to you're on horizontal.
How do you do that?
You wanna
Okay.
go
Let's see.
not so maybe it's the position of your phone.
No. All right. Let's put that here.
Yes. Fantastic.
Oh.
All right. Hi, everyone. I'm Dr. Rakhee, and joining me is Dr. Shazlina Othman. I'd like to welcome everybody to my first Instagram Live, and I'd like to have a personal thank you to Dr. Shaz. Can I call you Dr. Shaz?
Of course.
Yeah?
Yeah.
Yeah? So thank you to Dr. Shaz for being my first guest. So special.
You're welcome.
We're going to kick off our first session today with her, and she's going to talk to us a little bit about her experiences managing patients in her COVID-19 ICU. And I'll let her introduce herself in a bit. But before we start the whole session, let me just give a little bit about background of COVID-19 in our country at the moment. So we're seeing a surge in cases, right, in the past couple of months, especially in the past April and May. And if I'm not mistaken, we touched our first 100,000 in the first year of 2020. The whole year was 100,000. And we've been topping up until we're almost 500,000 patients in this year itself, 2021. And with the rise in number of cases, we're also seeing the rise in number of ICU admissions and the rise in number of deaths as well. In March this year, we were looking at only about 200 to 300 admissions in ICU. And at the moment, we're looking at close to 1,000 admissions nationwide in our ICUs. All hospitals everywhere, government as well as private hospitals, have increased the number of ICU beds that they have at the moment, and trying to get more staff in and more equipment. So it's taking a toll on everybody. And just for everyone to know that the highest number of admissions in ICU at the moment is in Klang Valley, of course. We've got Malacca, Sarawak, and Perak joining us very closely behind. And with the rise in number of cases, we're also looking at the rise in number of deaths as well. So we touch our first 1,000 over deaths in this month itself, and the whole month of the whole year of 2020 was just 500. I think it was just 500, and our rate of death has doubled from 0.3% to 0.8%. So these are just startling numbers to throw out to everybody so that we get a picture of what's happening in our ICU at the moment. So I will leave it to Dr. Shaz. Would you like to tell us a little bit about yourself and describe what you do?
Right. So I'm doing something completely different from what my master's is. I'm currently studying for master's in aesthetic medicine. So nothing glamorous at all about being in a COVID ICU. I can't, thanks for inviting me today. So I could
Can't look as gorgeous as this wearing the full
on and do my
PPE.
hair, because I'm usually in PPE. And I've got permanent lines on my forehead now. Even Botox can't save me, even though I'm studying it. But yeah, very unglamorous position at the moment in COVID ward with COVID ICU, and we've expanded, doubled our ICU beds because of the high demand. And since KKM opened up private care for COVID patients, we've seen a full ICU and full COVID ward since then. And now there are startling numbers. Obviously, with I think yesterday the stats were 872 ICU COVID-19 patients around Malaysia, and with 419 patients needing ventilation. So yeah, it's pretty sad to see patients deteriorate. It happens really quickly. So usually patients will come in after being tested for COVID-19, COVID positive, after a week or two being sick. And the critical day or critical time period in a COVID patient is when it's day 8, day 7, day 8, day 9. And it quickly, or for the high risk patients, it rapidly progresses to COVID pneumonia. So a brief introduction about COVID categories in the COVID-19. So there's category 1 to 5, and category 1 and 2. Category 1 has no symptoms, which is about 70 to 80% of COVID-19 positive patients. So that's scary. And they are spreading.
So these are the ones that we call asymptomatic carriers, right?
So
because they have no symptoms, but they carry the disease.
No symptoms at all, and usually won't get checked because they don't know that they're carrying it. They don't know how they got it. Most of my patients in the ward, they don't know how they contracted the COVID illness at all. So category 2 is symptoms but without pneumonia. Category 3 is with COVID pneumonia and needing oxygen. No, category 3 is with COVID pneumonia. Category 2 is symptomatic with no pneumonia. Category 4 is COVID pneumonia needing oxygen. Yes, so category 5 is already in ARDS, or acute respiratory distress with oxygen, sometimes with multi-organ failure. So you're seeing distress in all, you know, there's sepsis and you can see all that. So category 5, you know, there's a high risk that they get intubated in the end. So that's what we see in the ICU. And we keep them there. Obviously, in a private ICU setting, we can treat patients very very carefully, you know. So every patient is getting, obviously in government as well, but in the government sector, they are overwhelmed at the moment. So for those of you who are in the ICU or really in category 4 and category 5, they are actually choosing patients to go on ventilators or not, and giving those who might actually get intubated and extubated with a high rate of survival. So those who are not might not get it. And this has happened to a family member of mine actually in Johor. So yeah, my sister-in-law's mum had it depends on your comorbidities as well. If you're 70 plus, 50 and above actually, and you've got diabetes, hypertension, hyperlipidemia, end-stage renal failure, the likelihood of you getting a ventilator when there are patients that would pull through is less likely in the government sector. So this is a true story. My sister-in-law, her mother on day, I think about day 8, day 9, deteriorated. And in the morning, they informed her that, okay, we're gonna put her on a ventilator. And in the evening, they rang her up again after further discussions with consultants and said, sorry, we're gonna have to give it to someone more likely to survive the ventilation. So sadly,
it's a very difficult decision.
Yes, and sadly, her mother passed away last week. So
so sorry to hear.
And both parents were in the hospital. Father has been discharged, but you know, it's a very sad thing to see happen to the family. And unless it happens to your
sad for parents. Sorry, it's sad for family members to go through this and have to listen to the doctor, and it's also sad for the doctors to have to make the decision who is more likely to survive and who is not, you know. So it's such a difficult decision, as we're both doctors and we know that it's never easy. And me being in the pediatric field, I think I could never speak to anybody and say, I'm going to pull the plug on your child. I'll do probably everything I can to save them. But in adult medicine, I think it's a lot different, and you really look at their comorbids and also their life their life, what do you call it, ADL, your activities of daily living. If you have a bedridden person versus someone who could pre-COVID could walk and talk and things like that. So you're looking at all these things as part of the comorbids when they decide who to, you know, give the ventilator to or not. Let me just backtrack there to category 5. Category 5, when you mentioned intubation, that also means these patients are ventilated.
Yeah, so
Right?
there's
So not yeah.
category 5
So,
that we see that we put on NIV, which is
yes.
non-intubated ventilation, and there's complete ventilation. For those of you who don't understand this, it's you're putting the patient to sleep and let a machine
Yes.
work for your lungs so that
Breathe
the
for them.
patient still gets
Yes.
oxygen, because the lungs can't produce its own oxygen from the pumping, and you need to be on a machine to help them. And
To help you breathe.
yeah, so it's
and this is different. So the ventilator is different from ventilation. Just to make it clear with the whole fiasco last week, you know, ventilator is the machine, ventilation is the whole process. So it's a bit different. So there are 5 categories. Let me recap. There are 5 categories. Most of us are in the category 1 and category 2. And the ones that you're seeing now are the ones in ICU, which is basically category 3 and above. But at any category, they can deteriorate very fast within hours or within days, right? How many patients do you usually see in a day?
So it depends. It's been crazy. At the moment, it's pretty full. And well, I manage with my consultants the whole COVID ward. So we see we used to see category 1 and 2 who used to come just for quarantine. Or if there's a pregnant woman coming in without any symptoms, she needs to be placed under observation, should be inside our ward as well. But it's okay for a private settings because you get your own room. You get your own room, and you know, you have the privacy, and you have or PUIs. We have people who are having respiratory diseases who have not been diagnosed yet or have done the rapid test and they're waiting for a PCR. So we have the PUIs as well, person under investigation. And then when they're positive, we'll move them to a COVID positive room. But we have the flexibility to do this because it's in a private setting. Obviously in the government it's more open, and like in the quarantine centers it's more open as well. So you know, everyone is there and put in to the beds, and you have no sort of personal care, which is, you know, but obviously in private setting you're paying a lot of money. So one night in the ICU, depending on what you need to do, this is just for you guys out there, it can go up to about 40,000 per night in the ICU. So we've got, you know, patients having to sell houses and coming out with bills of hundreds of thousands for critical care in the ICU, because, you know, if you're a paying patient, ventilation, intubation, obviously we do everything we can in the private sector to keep you alive. But obviously in the government, you know, it's very, very, like I said, 872 critical patients in ICU now. So it's a pick and choose sort of situation. We're already at that level. So, you know, we need to keep it under control.
Can I also ask if you're seeing more younger patients in your ICU at the moment, or I mean, because it's kind of worrying that we're seeing more and more patients that are dying. I mean, I'm looking at the death rate on a daily basis nowadays, and I'm looking at the ages, and I see a lot of young people dying with no comorbids. And what's even more scary is we're seeing, I think, about 10% that are brought in dead. So these are people that, you know, they probably had no idea they had COVID and they just died suddenly. And you know, you're brought into the hospital dead, and that's when we do a swab and you're positive. So it's very scary. That number 10% is really huge, and the number of younger people dying is also increasing. So that's really scary to me. Are you seeing a lot more younger people?
We have a great mix in the ICU. Generally, it's mostly the 50s and above. But we have in the normal ward, because it's private care, like I said, we can have oxygen in the room. And when we switch the patients to an ICU, if they're needing more than 5 liters of oxygen, because by then you need to be monitored closely. And I think we are very overwhelmed in the fact that we need more nurses because nurses in the ICU themselves need to be trained, ICU trained, because they need to do lines, they need to monitor the oxygen levels, they need to know if the patient's connections are well put in, you know, so they need to be ICU trained. So we're getting a lot of strain. Over the Raya period, we had nurses doing double shifts, not being able to take Raya leave, you know. I mean, I even went over to the hospital to send them food because they were working on Hari Raya, and this is really what's happening in all sectors. So not just the government now, even in the private sector. So
even in private sector,
so that, you know, we need everybody to be vigilant, to stay vigilant, to follow the SOPs. Now that we're in total lockdown, be prepared to, you know, we've been through this already. It's just another few more months to get this under control, because until it happens to you, until it happens to your own family, you won't know the loss or how important it is to be very, very careful at these times, during these times.
And we all seem to think that it's not going to happen to me. It's definitely not going to happen to me, you know, but when it does happen to you, then you go like, I should have not done this. Maybe I should have done this. Should have worn a mask, you know, maybe I should have double masked when the DG was doing double mask, you know. So which brings me to my next question. So how do you stay safe, and how do you keep your family? I know you have 2 children, beautiful children. So how do you make sure that you don't bring anything back from ICU to them? What is your advice to people out there, you know? What should we do? My hair's wet because I just came back from hospital as well and took a bath.
So in the hospital, what we do is we go in and we change into our scrubs, hospital scrubs, and we treat patients, and we have to be very, very careful, because when we're not in the COVID ward and we're out and about, we still, you know, it's still us. So we need to be properly donned up in PPE every single time we see a patient, and we shouldn't scrimp on that. You know, we should be very careful at all times. So it's important for us to have full cover, you know, so when we have lots of ICU patients, this is me the whole day with the N95, and I need a rhinoplasty and lots of Botox after this, but seriously, I don't know where my nose is going.
I'll be right behind you on that.
I've got like acne, they call it mass acne now, everywhere. Not been able but yes, so it's important for us to keep the PPE on safely throughout. Then before going home, the SOP is to take a shower, wash my hair every day, take a shower before going home, change, and then go home. And then only, you know, do I dare to see my kids. But even then, I still try to keep it to minimal contact. So sometimes I need help with the children, so they're with my parents and stuff, and you know, parents are 70, so obviously minimal contact there. So those of you, even after vaccination, it's a bit like the influenza vaccine, you know, even after the shot you can still get it. So yeah, I mean, those with the hype of, oh, how come when we're getting vaccination we're getting it? Because it's a virus, you know, and it will minimize your symptoms, but you're still carrying it to those who are high risk. So everybody needs to be extra cautious at all times, washing hands, because fortunately this virus does die when you wash your hands with soap and water. So we are very careful in the hospital. Sanitizers everywhere, and washing hands all the time. That really helps. So for those patients,
I think it's sorry, you were saying for those patients?
So with patients in critical care and stuff, it's especially important for all KKM hospital staff to keep these in mind, you know, cross contamination everywhere.
And I think one of the aspects of PPE, which is personal protective equipment, for those who are not sure what PPE is. So one of the aspects is donning and doffing, so which means wearing your PPE as well as removing your PPE, because now you've got contaminated equipment or whatever that you're wearing, and you want to make sure that you take it off in the correct manner. And we as healthcare professionals are taught that in multiple ways, but slip-ups can still happen. So we still have to maintain our SOPs by wearing our masks, keeping our hands clean, getting our vaccines when it's due time. And I think it's really important to make sure that we don't bring back any diseases to back home, you know, because we've got the little ones at home and the older ones at home as well. So we want to make sure we keep that as sorry. we keep them as safe as possible.
I mean, continuing with that, you have to
Yeah.
be cruel to be kind, you know. My
Yes.
7-year-old's like, "Mommy, why are you not with us every day?" And he cries when I'm not there. He cries when I can't be there all the time. But at the same time, I say, you know what, Michael, you know, you can video call me anytime you want. And it's hard for us because, you know, they've had you day in, day out with them, and now it's just Mommy when she is okay to see me, kind of thing. And he comes running to me when I get through the door, you know, and I say sometimes, no, wait, let me just be extra cautious and change and have another bath or something like that. But he's like, I don't care. And I said, I care. So it's really difficult for us.
Kids don't understand that, I guess, you know, and we're just doing what we can as parents to make sure we don't bring anything back home. So I think we sort of got an idea of what's happening in the ICU. We're seeing a lot of cases, as you mentioned. Cases are rising. We really need to do our part in the community to stay at home and, you know, follow the SOPs, because herd immunity is nowhere in sight at the moment. So I hope the vaccine program ramps up, and it looks like it's speeding up. Yesterday we had almost 98,000 people vaccinated in a day, so I think that's a really, really good amount. And if we can maintain at above 100,000 a day, we're going to achieve something rather than nothing. So I think we've come to almost the end of whatever I wanted to ask you. Any last messages that you'd like to just say out there, or any messages from the ICU team to the rest of us?
So yeah, for everyone, please, briefly about, you know, ICU treatment. We give oxygen support, ventilation, and seeing these patients deteriorate really quickly is very, very sad. So within, you know, I've seen patients of mine having to say goodbye to their loved ones. And again, we're in private care, so we allow them to come and wear their PPE and say goodbye. Obviously in the government, you can't do that. So it's very sad to see patients deteriorating because, you know, the final moments, they're there for weeks, some of them months, and I'm seeing them on a daily basis, and you get very attached to them because they have nobody emotionally. They need our support as doctors on a daily basis. So I make an effort to go and chat to everyone, keep them positive. So one patient that I saw, he had 2 heart stents, so a history of IHD, of course, and he ischemic heart disease, for those of you who are, you know, like heart problems, and he would do yoga breathing and meditate at least 3 hours a day. So he came in like a quarantine patient. He came in and he left without oxygen. So I think another message to everyone is positive mental health is very, very important. So families who have patients in ICU, please continue to video call them and support them, you know, tell them we want to see you, and please keep strong for us, because that is very important for a patient, because you're without friends and family at long lengths, and it's easy for you to sink into depression in the ward. So I make it a point to go in with my PP and chat to them, you know, just to say, oh, you know, uncle, I'm gonna walk you out that ward one day. And it's nice when I can do that, but for the patients that I lose, it's very, very sad, and it will affect me for days after, because, you know, you're seeing them on a daily basis. And there was one point where I couldn't walk in front of the ICU because we had lost a patient who was she was intubated and extubated, and when the family got very close to the family came in one at a time wearing PPE, but even then could only see her from far and say goodbye, you know. So they were screaming across the ICU room to say goodbye to each other. So it was very sad, you know, being in a seat N95 crying for 4 hours was what I said. And I had gold.
Oh, I saw that post of yours, and it made me cry as well. Oh gosh,
I had goldfish
it's a horrible thing, but you're doing a fantastic job, and we salute you and everybody who is in ICUs and in hospitals, government and private, in every way. And keep yourself safe, and you're doing fantastic. And I especially love that you brought up the mental health bit, because we all need to stay positive, not COVID positive, mentally
Yes,
positive
mentally positive.
at this time, because I think it's really, really important. So thank you so much, Dr. Shaz, and
A few tips for
keep
those at home.
Yep,
Yeah,
yeah,
one thing is yoga, meditation,
go ahead.
breathing exercises at home. For those of you who
Yeah,
are COVID positive who are not in hospital, get a pulse oximeter, get a spirometer to open up your lungs. Yeah, so
lungs.
if you are COVID positive, you're feeling it difficult to breathe, obviously get checked first. If you're at home being treated at home, lie prone position, because you know how the lung is, it curves in the front, so there's more mass at the back. So when you're lying
Yes.
prone
So prone
on your
is your
stomach,
chest down. So
yes,
you're lying on your
on your
tummy. Yeah.
tummy and
Yeah.
chest, so downwards, because what you're doing is you're opening up the areas at the lung
Back.
spaces, and
Yes.
that means you can breathe much more, and make sure you have a lot of padding on the front, because it can also cause pressure sores. And don't do it right after meals, because it can cause aspiration. So
Correct.
spirometer, you can get it at any medical supply store. Pulse oximeter, BP
Oximeter.
monitoring, those are things you can do at home. And obviously stay at home and stay safe for everyone. Those who don't need to be outside, don't go outside, because in the government
Yes.
hospital, they don't do CT scans for everyone. But the thing with COVID-19 is you see ground glass appearance on CT scan in areas that normal pneumonias don't attack. What happens is the
So
COVID also comes in, it attacks your lungs, and then it makes your own immunity attack its own lung tissue. So that's how hard it is. And so your normal immunity is attacking your own body at the same time. So, in the government sector, we give immunomodulators, which is 4,000 ringgit. So they're not giving it in the government.
Yeah.
And we're seeing
One dose is 4,000
yes. So we're
ringgit.
seeing patients
So
get good care or get better, not going to ventilators with this drug. But obviously in the government sector, it's not there. So please be very cautious. Minimize contact with your loved ones, the high risk people. Get vaccinated. I think the government should make it compulsory for a fine for those who have signed up and don't go, because there's a thing called cold chain, and if we have the vaccine out and people don't go, it's going to go to waste. So once it's open out, it needs to be sub-zero, minus 70, and if it's out in the open without this cold chain, the vaccine is no longer effective. So it goes to waste, and we don't want to be dumping these at a critical time. And don't worry about the side effects. It's a mass vaccination. It's never been done before. So you do see some side effects here and there. Don't be worried. They're never in the history of our lives have we seen a mass vaccination like this. So, sign up, go for it. Don't waste it, and don't let other people, who haven't been able to get their turn, don't deprive them of it. It's very wasteful and very stingy. And as Malaysians, we should be taking care of each other. So let's get out this pandemic, because it's a hopefully once in a lifetime thing. So we need to get it under control, so we can all, so I can see you again, Rakhee, one day.
Yes.
It's been too long.
Been too long. Yes.
So yes.
Yeah, thank you so much, Dr. Shaz. Those were fantastic tips, and I think it's not easy. Like at some point, when you say fine for those who don't turn up, I also don't want you to be positive and turning up at the vaccine centers. So if you have symptoms, you have all the right to delay your vaccinations. Get yourself checked up as well.
And now the government are giving free
safety
swabs.
first, health first.
There are free swabs.
Yeah, and Klang Valley is all free swabs. So if you're not sure, just get it done and safeguard your family. Yes, I agree with you absolutely. Thank you so much, Dr. Shaz. It was wonderful talking to you. Yeah, so let's hope that this whole pandemic finishes and I get to see you personally. All right.
So all healthcare workers out there, you guys need to keep positive and take care of yourselves as well. For me, it's running, so you can still go running and do whatever it takes.
No cycling though, just running. No cycling though, just running.
Because people like to go cycling together. Running, you just require your legs. So yoga, meditation, keep yourself positive, keep yourself happy for healthcare workers, for those of you at home,
Yep.
do these things with your family, because you're taking care
With
of your
your
family. And as a carer, as a provider, you need to be positive. You need to stay safe and healthy for you to function optimally in the home. So
Yes, absolutely agree. All right, then take care. I'll see you.
hopefully soon.
Bye.
Bye.
Soon.